Okay, and just to give everybody a heads up, we are going to be recording this, just so that if anybody wasn't able to make it, we're able to help share these resources. So just a quick reminder that it is being recorded. Okay, and I think we're going to go ahead and get started. And then as people join, they can just kind of trickle in, but we will go ahead and get started with some introductions of the panelists. So hello, everybody. I'm Rachel. I am the founder of Allara. As many of you may know, I founded Allara a lot out of my own personal journey with PCOS and really struggling to find better care. And so really excited to have so many people here to share resources with and connect with. And then in addition to myself, we have Dr. Stacy Henigsman from the Allara team. Dr. Henigsman is our medical lead at Allara, so she not only sees patients, but she also helps to direct kind of all of our cutting edge clinical care programming that we provide for women with chronic hormonal conditions like polycystic ovary syndrome. Although we now treat patients with a variety of care needs, including PCOS, endometriosis, thyroid disease, and more. I also wanted to introduce Desiree Nazarian, who is the director and a co-founder at Scene Therapy. Desiree has a specialization in intimacy and relational trauma, and she works alongside her clients to navigate the complexities of intimate partner dynamics. She's passionately skilled in the overlap between women's sexual and mental health. Scene Therapy is a group therapy practice providing healing and therapy to women looking to build intimacy with themselves and others. So I'm so excited to have all three of us here. I think it's going to be a really great, just kind of variety of perspectives for patients to get to hear, or potential patients or women just who might be struggling, hear both from kind of the medical point of view as well as from the mental health and therapy point of view. And so maybe to kick things off, Dr. Henigsman, could you help just introduce PCOS and some of these hormonal conditions that we're talking about and help ground us in some of the science here?
Yeah, absolutely. I'm so happy to be here. Thank you, Rachel. So I'm going to go over a little bit of PCOS. So it's basically a disorder characterized by hyperandrogenism or high testosterone, ovulatory dysfunction, and polycystic ovaries. And we know the prevalence of PCOS is rising and can range anywhere from 5 to 20% of women, depending on the demographic that is studied. And we really know that depression is 3 to 8 times higher in women with PCOS, and that around 40% of women with PCOS are going to experience anxiety. So we have to ask ourselves, why is this? Well, we know that about 70% of women with PCOS have insulin resistance and chronic low-grade inflammation just from the condition itself. And studies have shown that insulin resistance and inflammation can decrease levels of serotonin and dopamine. And women with PCOS, in fact, have been shown to have lower levels of serotonin, dopamine, GABA, and acetylcholine, which are all really important neurotransmitters in the pathophysiology of depression. And so there really is a physiologic reason that makes women with PCOS more likely to report anxiety and depression. So really is a physiologic issue with this condition that is going to predispose you to anxiety and depression. And I'm sure that Desiree can focus more on this also.
Yeah, thanks so much, Dr. Henigsman. That's a lot of information. I think what that speaks to the complexity really of this hormonal condition. And what I'd like to do is I just want to give a warm welcome to everyone who's here tonight. I'm really excited to be here with you, Dr. Henigsman, and you, Rachel, and to have this collaboration, because I think to that point, there's so much out there about the medical and the physical about PCOS, but there's not enough yet around the implications on mental health for women. And this is one of the reasons why, when I approached you, Rachel, and Dr. Henigsman, we got together and we were all like, let's talk about this. Let's name it. Let's put it out there. So I'm really excited. And my hope is that I can shed light on this for any of you who are going through this or have identified with some of these mental health complexities as well. So like I said, I'm going to shed some light on this overlap between PCOS and mental health, specifically how the medical symptoms are not just physical. They really affect the way that a woman views herself emotionally and psychologically, and how a woman essentially moves through the world as a result of that. So anything that has a physical component to it, anything that has these physical or external facing symptoms to them, it's ultimately going to have some type of emotional component to it as well. And to just piggyback off of what Dr. Henigsman said before, we know that there's a little bit of research right out there about the mental health connection, but one of the main framed pieces to pull apart is that PCOS, women who have PCOS are 3 to 8 times more likely to suffer from symptoms of severe anxiety and depression, right? Just that there gives us such an indication of how this condition is complex and connects to the mental health overlap. So what we're really looking about tonight, and I'm going to unpack for everyone, and hopefully it's palatable for everyone, is this mind and body connection, especially for women. And I want to break it down for everyone in these 5 different type of constructs. What really happens to women who have PCOS and the implications for mental and emotional health. So the first one to kick it off is isolation and grief and shame, and loss, really. So when I think about grief and loss in respect to PCOS, what I'm really thinking about here is losing a part of your identity and the isolation that comes along with that. This is such a complex medical diagnosis and condition. So even just taking all that on and having, I don't know this information, or I just learned a new bit of information, or my doctor told me this, can be a lot to take on, as well as then trying to find people to support you through that. Finding supportive people who get it can feel really isolating. And for women with PCOS, it's sort of like feeling like you're living with grief and loss, because your body's changing on the inside and outside. And when you have PCOS and have these symptoms, they're literally changing the way that you feel and look. So you may experience some grief here, or experience the loss of who you were before, right? Who you were before your hair started to fall out, who you were before the menstrual complexities, the mood changes, these irregularities, and grief comes into play here. And I think what's important also to note here with grief is that in mainstream society, when we look at grief and we think about grief, we're thinking about typically death, right? We're mourning the loss of someone who has died, which is the typical way we grieve in society. But with PCOS, it is a form of what we call disenfranchised grief, which is grieving a loss that isn't necessarily a death, but it's a different type of grief that's not really spoken about as much. Maybe society doesn't understand it. Some physicians or clinicians don't fully understand it or validate it. So that in of itself is a form of grief. And finding a therapist and a medical provider who can really listen and can empathize with that and hear you is key here. The next construct that I wanted to bring is this idea of self-blame. Feeling misunderstood here and feeling shame around this diagnosis. Again, if you have PCOS or you know someone who does, it is quite possible that you are experiencing these external symptoms. And that means that your body is changing, and so is the way that you're viewing yourself. It's changing your mindset and altering you, the way that you feel, and that can become really internalized. Maybe you have this constant stress about what is good to eat, what is bad to eat based on insulin resistance, right? How many times have we heard, right? Go gluten-free, go dairy-free, do both of these things, do one of those things. There's so many things, how many things? And what we know is that women who have PCOS are 3 times greater at developing binge eating disorder. So these are really important things to note and be mindful of as you walk through this journey. I also think about, the self-blame around all these constructs of what to do as a result of your PCOS, and maybe feeling like, well, if I didn't walk those 10,000 steps a day, I'm feeling really bad about that. Or having 8 hours of sleep and then waking up and still feeling like you're foggy and you didn't have any sleep, or what's wrong with me? Why am I feeling this way? Or feeling even judged by certain people in the workplace for having that lethargy, feeling lethargic around that. So I just want to name those. I hear you, I see you. And meanwhile, you're going through all these different shifts and irregularities. So if you're having these thoughts and internalizing them, we're going to get to some more tools and tips for action steps for you all a little bit later, Dr. Henigsman and I and Rachel, but I do want to just encourage you all to be really patient with yourself, have a lot of self-love and respect for yourself and what you're going through here. The next piece is around preoccupation of your body image. So because there's a large external component to PCOS, polycystic ovarian syndrome, such as excess hair growth on the face and the body, or hair loss on the head, acne, weight changes, all these different components, fertility, this can really have the ability to affect one's mood and one's self-confidence and body image. And many of these different types of external facing symptoms have the potential to challenge our ideas about femininity as women and how women are supposed to look or feel. Or someone can internalize and feel preoccupied about checking, for chin hairs before leaving the house, right? Avoiding certain social situations, rapid types of intrusive thoughts around, can somebody see what's happening, on my head, or covering bald spots or acne? So these are all things to take into account. And there's also a piece about a woman's sexual disruption or challenges that may come about in developing more of an understanding about PCOS with your body and your experience with wholesome sexuality. So the way that you're experiencing your body is changing, and the way that you're experiencing your body in relation to perhaps sexual partners may also be changing. And if we think about it, like this is a hormonal condition, that means it has impacts on your sexual health in some way, shape, or form. So if you're not feeling good about your body, right, how does that impact relationships? How does that impact intimacy? And I don't just mean the sexual piece, even though we're on it right now, also mental, emotional, physical, intellectual intimacy, having the ability to be myself and with other people and feel like I'm not going to be judged. I feel like I can be all of me. And some women have shared that, and there's a lot of studies actually out there about PCOS and women having less satisfying sexual experiences. And what I would want to offer you all with this is find a therapist who specializes in sex and intimacy if you are having difficulties with this in here, and really value yourself to give yourself that in conjunction with a provider who gets it. So the last thing I want to talk about is how with PCOS, it's really easy, right? How could it not be to feel overwhelmed? I hear you and I see you around this. And a lot of people with PCOS may describe their feelings emotionally as, I'm not coping well with all of this. It's, too much to go. I still feel like I'm doing the things, I'm doing the meal preps, I'm doing the dairy-free, gluten-free, I'm taking the medications, I'm doing my pills, right? All my supplements in those compartments, the pill boxes, but it's just not, I still feel dysregulated. What we know about PCOS is that our bodies are constantly pumping out these stress hormones, which are going to affect your system. So when we look at our nervous system, that's what's dysregulated, right? Being in a sympathetic, we all have a nervous system, right? The autonomic nervous system. And there's two poles, essentially, the sympathetic and the parasympathetic. And so if your body is constantly pumping out these hormones and these these feelings, right, we're going to sometimes experience this flooding of sorts that happens with our nervous system as well. And it can be really difficult to regulate that, or to feel like maybe I'm doing something wrong, or I, don't have a full understanding or grasp around this. You are not coping well. Your nervous system is dysregulated as well. So what we want to encourage you around here is to remember, one day at a time, one thing at a time, rinse and repeat. And I don't expect someone who has this diagnosis, especially if you're first starting to learn about it, to be at 100% and operating. So give yourself that grace to understand, okay, like I can give myself 50% today, and I'm going to give another 50 tomorrow. So that will help, such as, and other things with meditation, with yoga, with different type of practices that we'll get into a little, action-oriented steps in the moment to be mindfully attuned to your body and what's happening, will help you to get to parasympathetic, which is the rest and digest part of our nervous system. So I'll stop there, and Rachel, I'll hand it over to you.
Amazing. Well, thank you so much, Desiree. I think that was just a really helpful breakdown. I think somebody put this in the chat, but similarly, I think a lot of that just really resonated with, my own experiences that I've had. I think especially you speaking about kind of the overwhelm and the self-shame of like, okay, I have 15 million things to do. Somebody told me I have to go gluten and dairy free. And then a different person told me that I have to try this supplement. A different person told me not to do HIIT workouts. And it's like navigating all of that when you don't have a medical degree, and then feeling shame around knowing what to do and not being able to, necessarily do all of that, I think can be really tough. And, frankly, I think that's a lot of the reason that I did start Allara, was because I felt like there was just so much noise out there from all of these people who would, try to be helpful or try to be supportive, and you're just hearing so much noise. And really being able to make kind of expert-based care from, doctors, from dietitians available to me was really important. I know something that you touched on was finding those providers, whether they're a therapist, a medical provider, who, can really understand you, who can really be empathetic with you. I just want to understand a little bit more, if you have any tips and tricks of women who are, as we're navigating the medical system and maybe finding doctors who aren't as empathetic or kind of dismissing us, like what are some tips and tricks there for both of you to dealing with maybe providers who aren't always as empathetic?
Yeah, and so I'll go. I think that's really, really important, because PCOS is such a personal thing that women deal with. And if you don't feel supported by your medical team, then I think you just need to go find someone else. And it's very, very difficult. You need to find someone, number one, that is very knowledgeable about PCOS, that has studied it, that didn't, take a little bit of time during residency to go over this. So for my residency, I trained in California, and we actually had a PCOS clinic every single week for 4 years. So I would see PCOS patients every single week for 4 years, was taught about PCOS, taught about the diagnosis, best ways to treat it, how to manage it. So really you need a knowledgeable medical provider that's going to be supportive and really kind of walk you through it, because like Rachel said, if you're just had this diagnosis, you're going to feel overwhelmed and you're not going to know, well, what do I do? And so you need a provider that takes time with you, that understands the condition, that will work with you, because there's not a one size fits all for PCOS. So what I do for one patient is not going to work for another patient. And so you really need to find a provider that's willing to work with you and come up with the exact right treatment for you. And so sometimes it's very difficult to find that, but if you just keep looking, you definitely will. And that's why Allara is so great, because it's a team of medical providers that know PCOS inside and out, work with a dietitian. And so you need to find something like that that really resonates with you.
I couldn't agree more, Stacy. It's so important to know that you have voice and choice in this as well, even when the expert in the room, right? And I say that because even as a psychotherapist myself, like I have the tools and I have everything, right? you know, as far as the clinical background and a medical provider like Dr. Henigsman, like you, but you are the expert of your own body at the end of the day. You truly are. And so I know that it can feel threatening and uncomfortable to, you know, have your hands put in someone, you know, a provider, and like hoping that they really get it and understand it, but finding someone who actually does. And I want to take you through like navigating how that actually happens, right? How you can look out for that is so important. And I think it's also important, and I'm just gonna say it. This word has been buzzing around in mainstream media for a really long time, especially now, the term gaslighting. And there is also a component to this, which is called medical gaslighting, which happens. And it's the way that the system, unfortunately, is set up, right? Within medical provider offices that aren't like, you know, Allara and other ones who really understand. And so medical gaslighting is basically when your needs and your concerns about your healthcare or your body are being downplayed, they're being dismissed, or they're being minimized. And this happens quite often, specifically with women's hormonal health and PCOS. Some examples that come to mind that, you know, I can just pull are being told, well, maybe you should just eat less, right? If you have this rapid weight gain that's happening, right? Or maybe you're not doing enough. My favorite, these are like the greatest hits that I have in my head around PCOS and different types of medical gaslighting. My favorite is, there's absolutely nothing that you can do right now until you're ready to get pregnant. That is not true. PCOS is so much more than a fertility issue. And sometimes it's not even a fertility issue for some people. So some of the things that, you know, you may want to consider looking out for when you're looking for a provider is, are they listening, right? What is their background? Are you frequently interrupted in the room? Does your provider seem engaged? Are they looking at you? Are they attuned to you? Are they really listening? I remember being in the gynecologist office a while back, looking for a new provider. And when my provider at that time, I've switched since then, came back into the room, she was reading my results off with one of her feet, holding the door to the office open so everyone in the waiting room could see and hear me. And I was in my gown, I was sitting, and she was reading them off like she was ready to get out the door. And I just completely froze, right? Even an advocate in this, even as a psychotherapist, I just completely froze in that moment. I was in a state of shock around it. So these things are happening. They're not happening everywhere, but I say this to all of you, that you have voice and choice in all of this, and you get to advocate for yourself in these different rooms and spaces.
And I'm curious, what maybe Stacy, like if you have any advice, if somebody is in a situation like that where they feel like in the moment, you know, they aren't being listened to, or they're being kind of gaslit, you know, anything, maybe like a tactical piece of advice you can give for when you're actually in the room dealing with that?
Yeah, I mean, I think that you have to, like Desiree said, you have to advocate for yourself. And I know it's super hard because you have this person of authority standing there, but you have to just say, look, this isn't acceptable behavior. I don't like how you're treating me. And just really advocate for yourself, because I can guarantee you, whoever's in the room with you is going to kind of take a step back, be like, oh yeah, you're right, I am doing that. And if they don't, well, then that's really a good clue that you don't need to be there. So I would just really voice your opinion, stand up for yourself, and tell them what is and what is not acceptable for you. And don't be shy about it, honestly. I mean, obviously, be respectful, but you just need to really stand up for yourself and advocate for yourself, because if you don't, no one else will.
Totally. And also, it's okay if you want to bring someone with you to the appointment. Like bringing a supportive person with you is totally okay. And preparing for your appointment is also something I would highly encourage and invite you all to do. Like keep a journal of your symptoms, track them. So you're articulating these to your provider and they have a good sense, and you also feel confident and grounded coming into that appointment.
Yeah, because sometimes you just feel overwhelmed and there's so many things you want to talk about and you're just like, well, what is everything? And so I agree. If you just pull something out and say, look, I'm having these symptoms, this is what's happening, then you're going to be able to express that, because I can guarantee you in the moment, sometimes you're going to forget and you're not going to, remember everything. And that's why I think a support person is so good. And if a provider tells you no, that you can't bring a support person in, then that's the first red flag. I always think another set of ears is really, really good for the patient, because the physician, the medical provider is going to say things and you're not going to remember everything. But if you have someone else there with you, they'll be able to listen. And again, I think writing things down is really, really important, because you're going to forget, at least I do. I forget things that I want to say. And so a journal and questions is perfect.
Okay, that's great. And just one really quick announcement. If the Zoom, we might have a small technical issue. If the Zoom does close out for some reason in a minute and a half, just click the same link again and we can let everybody back in. But just a quick heads up, if the Zoom shuts off for some reason, we're going to pick back right up in the exact same Zoom. So apologies for the potential technical issue. I'd actually love to get into a few of kind of the questions that were submitted ahead of this. We had a bunch of really great questions submitted, and then also feel free to send questions into the chat, and we'll try and get those answered as well. But it's just to start out, if somebody is finding that they're struggling, with their mental health, especially if they have mental health and PCOS, maybe they're like me and they struggle with anxiety. What are just kind of a few actionable steps, daily habits that you might recommend for somebody who feels like they're going through it?
Yeah, so there have really been some good studies on this. So studies show that just getting outside, movement, you don't have to do anything crazy, but just taking a walk is really, really good. Obviously, eating the proper diet is really, really beneficial. Things like acupuncture, believe it or not, they've done some very good studies on mental health and acupuncture. Getting a therapist, a really good therapist that listens to you. Cognitive behavioral therapy has been shown to be really, really good for women with PCOS. So I think taking more time for yourself and just walking and, being in, just to kind of so just more self-care and really giving yourself the grace to be okay in the moment. So taking care of yourself, spending time with yourself, I think there are really some good actionable items for anxiety, depression, those types of things. And I think Desiree probably has some more helpful tips.
Sure. I'd love to chime in here. Movement is such an important piece of this. Movement. Anything that's affecting our bodies again, we get to treat from the body. And so helping you to get out of this fight or flight state, this anxiety state, this anxious state through movement and grounding will be your best friend. Also, any type of stress management around this, but specifically, right, recognizing, like I was saying before, I don't expect you to do 100% and be at 100% with this every single day, right? One thing at a time, and rinse and repeat. The other piece that I don't think is talked about is what feelings come up for you in the moment around PCOS, right? You're about to go to a party, you're about to go to a social situation. What that really feels like for you, I will tell my clients, I'll whip out the good old feelings palette, right? Let's bring it out, print it out, put it on your refrigerator, put it somewhere, name 3 feelings that you're feeling in the moment. Right? Say them out loud. There are studies to show that when you're activating your vagus nerve, right, which is helping you to get to, again, that parasympathetic part, the digest, relaxation, right? I'm not, amped up. That if you're able to speak, right, sing, humming, all these different things, saying how you feel and giving voice to it can regulate and bring you to containment and less activation of your nervous system. So that's one of the pieces about the mental health perspective. And just really remembering that there are people out there who are willing to get an education about what you're going through. There are people out there that even if they don't know about it, they are, because they care about you and they are trusted people, in your life and you get to be the one to identify that, you can speak to. And I'd say choose wisely, right? You don't have to share this with anyone, but you can share it with who feels safe.
Yeah, I think those are all really great tips. I think if I could just add a few that I, lean on myself to share, I think I 100% agree, Desiree. I think movement is so key for me and my mental health. And I think it's also for me really tapping into, what type of movement is my body looking for right now. I think a lot of times what used to frustrate me was it'd be like, okay, if you have PCOS, like never run and never, never do X, Y, Z. But for me, it's been a lot more about tapping into like, what are my body and my mood craving? And so some days that's just a walk outside. Some days that's Pilates. But some days that's like a hardcore berries class where like the lights are pumping and the music is loud and I just want to like get it all out on the treadmill. And so I think it's like, I think really like being able to listen to your body and understand what it needs can be really beneficial. And the other thing that I've really found useful is to make lists. So if I'm stressed about something, I specifically will make lists of like, okay, what are all the things I'm stressed about? What are all the things I need to do? I'll write it down physically on a piece of paper. And I find that for me can be really helpful. I think so another question that came up before we started was to really kind of understand a little better this connection between hormones and mental health. And so somebody asked, have you seen a disruptive mood in patients with PCOS throughout the month or just in their menstrual cycle? And kind of how does your hormones and your menstrual cycle affect your mood and your mental health? And I think adding on to that, another question that was asked was, how can somebody tell the difference between like, I'm just PMSing or I'm feeling hormonal and moody versus, there's something more serious going on here that I need to look into?
Yeah, so I mean, I think if you look at how do you diagnose depression, I think that's really going to be key. So what it is a feeling of sadness or low mood or loss of interest in usual activities, and it has to be for at least 2 weeks. And it also needs to be accompanied by a couple of other things. So change in appetite, either losing weight or gaining weight, sleeping too much or not at all. If you're really, really tired, feeling hopeless, you can't concentrate, then that pretty much signals a depressive diagnosis. If it just happens right before your period and it happens right before your period all the time, then you're likely dealing with PMS. Typically, though, women with PCOS are going to be diagnosed more often than not with depression, anxiety, than just PMS right before your cycle. So if it is greater than 2 weeks, have these other symptoms with it, then that's likely depression. If it comes right before your cycle, goes away when you start your period, then that's more of a PMS. So the depression lasts longer, it's more severe, and it doesn't go away with your cycle.
Yeah.
So that's kind of how you tell the difference between the two conditions.
And if you are suffering from, say, anxiety or depression, does that get better and worse over the month with your cycle, or is that tend to be kind of unrelated to your cycle?
Yeah, it's really not related to it. It typically is there all the time. If it does get better with your cycle, then that's more of a PMS type diagnosis. Mm-hmm. And if it comes right before your period and gets better, that's more PMS. But if it's the whole cycle, anxiety, the depression, then that is more of a depression diagnosis than a PMS diagnosis.
Yeah. And also, it's not only depression and anxiety, right, that we're looking at and talking about. The brain fog, it's the memory loss, it's the constant fatigue as well that leads into all those other emotional pieces. And so I just think that, yeah, absolutely. Like you were saying, Dr. Henigsman, throughout, those are present, and being able to manage them is the most important piece of this through mindfulness, whatever that really looks like and feels like for you. Rachel, you were saying earlier, like, I'm starting to realize like what I feel from moment to moment that feels good to me in my body. And maybe that's going to feel good today, but in a week, that's not what I need right now. And just be really mindfully attuned to that.
Mm-hmm. Yeah, I think that's a really good point to keep in mind, is that you don't necessarily need to have a diagnosis of, say, depression to seek mental health therapy or to seek intervention or to seek care. I think that's a really good point to call out, that there's a whole spectrum and probably a lot of people could benefit from support.
Yeah, the majority, actually, I think.
Yeah, I agree. Um, Another question that had come up was around kind of body image. I know, Desiree, that's something that you spoke with, but something that we've heard from our patients, something that I've heard from other women is sometimes, you can get this judgment from external sources about your body, whether it's, a parent trying to be helpful who makes a comment, but it's body shaming, or sometimes even we hear this from doctors. Doctors make comments about, oh, just lose weight. That can feel a little shaming. So if maybe Dr. Henigsman more from the medical perspective, and Desiree more from speaking to your interpersonal relationships, what advice do you have here with dealing with people in your life who may make you feel ashamed about your body?
Yeah, I mean, sometimes it's not easy to get rid of those people, right? Like, you can't just say, okay, mom, I'm not dealing with you anymore. So, I mean, I really think, again, you try not to internalize this. And if you can, you have to advocate for yourself, right? So you have to stand up and say, look, I'm dealing with this. It's a chronic condition. I'm trying my hardest. And I think if you speak up for yourself, people are going to kind of step back and hear you, hopefully. And so, yeah, I think just advocating for yourself, don't internalize this. I mean, you have to realize that this is a condition that you cannot control. You did nothing wrong to get this condition. You cannot control this condition. This is something likely you were born with. And people need to realize that. So I think you can be the best advocate for yourself and just speak up for yourself, honestly.
Yeah, two things for me from my end. One is actually, like, you don't owe anyone an explanation. If someone is asking you something or making comments, you actually don't owe anyone an explanation, especially if you're not ready for it, especially if you have not yet processed what this condition means for you. The second thing is that this condition, this diagnosis, does not define you. It does not. So I think those pieces are important, but also in therapy, right? Working and finding a therapist who can help you to, one, understand the internalization of your core beliefs and how, some of those may be formed prior to this diagnosis, but then got amped up because of the diagnosis. That's a really big part of what, I do in my work at Scene Therapy, right? Really helping you to see what that feels like, those core beliefs that were formed. And the second piece is boundaries, right? Boundaries as women, like boundaries, ladies, right? Let's talk boundaries in therapy. So therapy can really, obviously I'm a firm believer and supporter as a therapist, but even in my own work, they have been game changing in understanding. And one of my favorite, sayings that I learned, I think it's a book out there or from a podcast, like, no is a full sentence, right? No is a complete sentence, right? I'm not doing that. So just keep that in mind as well, because I think in society also, as women, we are conditioned. There are certain cultural scripts and societal scripts that do make us feel that we have to give a response or we have to explain ourselves. But let's take a step back. You don't even have to.
Yeah, I think that's a really great point. I love that. No is a complete sentence. We did have a question in the chat, and feel free, anybody, and you can also leave an anonymous question, but feel free to drop a question in the chat. So someone asked, what are some of the symptoms that she should listen for with other women who come to treatment that might flag the need for a PCOS medical specialist? So maybe some things, if you're a provider, I know we had a couple of PTs in the chat as well, but some things that other providers can help keep an eye out for.
So you need to look out for irregular periods is probably the number one thing. So irregular periods, so periods that are either really short, like less than 21 days, or really long, so greater than 45 days. That's going to be one. Acne, if they complain of acne, or if they have cystic acne, if they complain of hirsutism, so not even just facial hair growth, but hair growth around your breasts, the lower abdomen, your back, your thighs. That's going to be another thing that you need to look for. Constant fatigue. They'll complain, a lot of PCOS patients will complain of difficulty losing weight. So those are the real things that are going to for the provider to say, I need to do a PCOS workup in this patient. So really, irregular periods, acne, facial hair growth, hair thinning, difficulty losing weight, fatigue, and mood disorders, honestly. So that is really the constellation of symptoms that your patient's going to complain of.
And also this diminished desire,
Yeah.
diminished desire for sexual intimacy. I think somebody's on right now and not on mute, so I just wanted to flag that if we could put that on. Thank you. Diminished desire, like if you're a clinician in this space right now and you're listening to this and you want to be able to help clients who are coming in, not just with PCOS, but other hormonal factors and diagnoses, right? Really, please look out for diminished desire, right? Something shifting, something changing that wasn't, historic or just feels different in your space with your client or for you yourself, if you're noticing that. Difficulties with being in social situations, if that's shifting for you, mood disturbances, as you said, all these different components, right? Isolating, not feeling confident anymore, low self-esteem, all these different factors to consider as well.
Yeah. I think it's really interesting that you brought up kind of that, desire element. And I think we actually had somebody write in a question at one point about kind of how to have these conversations with your partner. I think especially if you are in a heterosexual relationship with a man, like how do you suggest navigating these conversations around, around your diagnosis, around, potential pregnancy challenges, around your desire levels, like any advice there in terms of navigating a relationship and those kinds of conversations?
Yeah. If you have a partner and you're going through this, the way that your partner actually responds to you, both when you're sexually intimate around this and just when you are having any type of intimacy, is really going to be impacting you and how you feel. So if they're responding with shock or disgust or, judgment, right? Download that, right? That's something there. And it might be something that you want to talk to a therapist about before, and how to kind of bookend, okay, this is how I'm going to start the conversation and this is how I'm going to close it, and really understand for yourself, like, what is the message that I'm trying to send to this person, my partner? What do I need from them? What is my intention here and what are my goals? Do I need them to be more attuned when I, for instance, take longer in the bathroom, or when I wear certain things to cover up certain things because I'm not ready yet to, have that, and I'm grieving, and I'm grieving this loss that I've experienced, right? Just being very open with yourself about what those things are so that you can have those conversations then with your partner. If we are not aware of what our stuff is and what's impacting us, it makes it that much more difficult to be able to have that conversation with others.
Yeah, I agree with that completely. And again, I think as women, we need to get to the place where we can advocate for ourselves. I think that's my biggest thing I'm saying tonight is like, I think we really need to do that, because I don't think we do that enough in our society.
Yeah. And I really just want to, Desiree, I loved what you said in terms of like, you should actually be looking at how they're responding. And I totally agree with that. I think so many times, especially when we're disclosing these things and we're feeling a little self-conscious, we might think like, oh, they're evaluating me. But I think equally, right, you're evaluating them, and you're kind of like, is this the life partner that I want? And the way that you react to this news tells me something about that. So I think it's actually a really good point around like, actually all these people in your life, whether it's your doctor, your partner, like how they are acting, how they're responding, is actually valuable information to you and helps you get that agency later on.
Absolutely.
Any other questions that anybody has? Burning questions. We have a few minutes, or else we can end it. Okay. Amazing. Well, Dr. Henigsman, Desiree, any last minute thoughts or tips? Oh, we have a question in the chat. Let's wait and see what she said.
I'm also open to, if anyone is comfortable, to come on and share, but if you're not comfortable, you're more than welcome to just keep it at the chat, but we have some time, so whatever works for you all.
I guess in the meantime, maybe just like one final tip that each of you want to give the group as they're kind of navigating this journey with both their PCOS and their mental health.
Yeah, I mean, I think just find a provider that's going to work with you and partner with you. I think to partner with you is the most important thing. So that's what I would wish everybody to do.
Yeah, that's really good advice, Dr. Henigsman. Again, this condition does not define you and who you are. And finding support in the right places and taking it one day at a time, right? One step at a time. There are ways to manage this, mind, body, and soul, and you're not alone in all of this. You know, all of you who are on this call right now, I would imagine you're taking out the time because this is really important to you. And I honor that and value that. And it's important to us as well. And so just here, I don't know most of you, right, or all of you, but you are not alone just by recognizing that even the amount of women who are on this call right now are sharing an experience, right? And there are people out there who want to be of support to you and are going through this. So you're not alone in this.
Yeah, that's a great point. And so the question that did come in, and I'm going to just generalize this since we can't give individual medical advice on this call, but so it sounds like, kind of the question is, obviously a lot of women have used birth control to help manage some of their symptoms and also some of their, sometimes even some of their mental health symptoms. But if you're trying to conceive and you have to come off birth control, how should you think about that trade-off, and any advice to help manage some of that impact as you come off your birth control to try and conceive?
Yeah. And so this is a super important question, right? Because a lot of women just go to their doctor and that's what they say. That's their band-aid for it. It's just like, here's some birth control. This will fix everything. And so you really need to get to the root cause of your PCOS. Is this insulin resistance? Is this inflammation? Is this, adrenal issues? And so you really have to get to the root cause. So my advice would be to find a provider to get to that root cause, because coming off of birth control doesn't have to be a scary thing. As long as you can figure out what the root cause of your PCOS is, then you can work around that and find a plan for when you come off of birth control. It's not so scary. And you can, if mental health is a concern for you coming off of birth control, that's when you need to get a therapist in place. So what I would do is find a provider that will listen to you, find a therapist that will listen to you if those are your issues. And it doesn't have to be a scary thing. It really doesn't. You just need to find someone that will work with you and go from there. Because obviously you have to get off if you want to start a family, but there's good ways and not good ways to get off of that. So just find someone that you can work with.
I appreciate you bringing that up, Dr. Henigsman, especially the word scary, right? It doesn't have to be so scary, because I think that in our society, these words such as syndrome, right, disease, right, all these things evoke this fear response, especially for women who are going through hormonal difficulties. And it's a part of, right, it's like almost embedded within the system. Or infertility, right? Many medical providers don't have the full range of understanding of what PCOS is, and they just jump to infertility. And you hear that as a woman and you're like, what does that mean, that I'm never going to be able to have a child? That's not what it means, right? So that word really stood out to me when you said scary, right? As a society, right? Systemically, it's a part of the system.
Yeah, I think it's a really good point. I think frankly, that's a lot of what we've been trying to share here is, it doesn't need to be scary. It doesn't need to be isolating. There are a lot of women going through it, and there are a lot of resources out there. And just because you haven't found them yet doesn't mean that they exist. Okay, I think this is a good question, actually. So, disordered eating is kind of a newer condition in the realm of eating disorders that I think can sometimes seem like, well, if it's not, full-blown anorexia, it's not a big deal. But what are some things that you should be looking out for in your behavior that could be a red flag for this, and maybe any advice of what to do if you're noticing some of those red flags?
Yeah, I think the biggest thing for disordered eating is women will come to me and they don't realize how little they actually are eating, right? And so, or they'll say, well, I have to go gluten-free, I have to go dairy-free, I have to do all of this. And so when you actually sit down and say, what are you eating? What's happening? Realize that it is very, very disordered, because women will say to me, well, I have to starve myself and, eat 500 calories or I'm not going to lose weight. And then the next day they're making up for that by eating a whole bunch. So disordered eating just basically means it doesn't fit, again, the medical criteria of anorexia, bulimia, but it still is just as important because a lot of women with PCOS will have disordered eating. And so, again, you need to seek the advice of a really good physician and a really good therapist to help you work through that, because that takes a long time to break that cycle, because you've been dealing with this your whole life, essentially, and probably eating like that for a very long time. And so you just need the help to realize that, yeah, this is what you're doing and help you break that cycle.
Yeah. And again, the mind and body connection, cravings are such a big part of PCOS. So binge eating might come up, right? My blood sugar spiking. It's the insulin resistance. All of this is a part of the dynamic. So that's one of the reasons why disordered eating, right, can take hold. And just really noticing that, and noticing that also the amount of protein that you're eating may be less as a result of that too, which is super important with PCOS to keep that. And maybe getting a nutritionist, right, to help you go through that and to see what you're actually taking in for yourself.
Yeah. Yeah, I was just going to say, I feel like a nutritionist can be a really valuable resource. I think I kind of took for granted how much science there is to nutrition therapy until I actually met with one, and they kind of were able to explain, like, okay, here's why eating this is important. Here's why this food actually isn't so scary, to go back to that word. So I agree. I think it's, thinking about the medical help, the therapy help, but also like a registered dietitian can be really helpful in that case as well.
And I think you have to put together a multidisciplinary team, right? So you have to put together the dietitian, the mental health counselor, the physician, because this is a really complex chronic condition. So you need to put together a team to care for you.
Yeah. Okay. Well, I think we are about at the end of our time. So I want to thank everybody again so much for joining us. I want to thank Dr. Henigsman and Desiree so much for your time, your guidance. I know I learned a lot from this. We're going to follow up with an email to everybody with the recording, as well as kind of a few takeaways. And we'll put some contact information on there as well, so you can learn more about Allara, more about scene therapy, and see if either of those resources, are helpful to you. But thank you again so much to everybody. It was so nice to have this conversation.
Thank you, everyone.
Yes, thank you.
Part of this
Thanks.
as well.